I'm Kevin Lindemood. I'm the President and CEO of Healthcare for the Homeless. We go out on the streets to get people off the streets and back into the mainstream. We've been in Baltimore for about 28 years. We provide comprehensive medical care, mental health services, social services, addiction treatment, outreach, pediatric and adolescent services, targeted HIV services to about 6,000 people in Baltimore over the course of about 70,000 patient visits a year. We're one of about 230 federally funded Healthcare for the Homeless projects nationally, and a group of about 100 of us work collectively as the National Healthcare for the Homeless Council. You can't make ends meet, can't pay your rent. You end up making impossible choices between food, shelter, clothing, and too often you face the choice of turning to shelters, or if the shelters are full, as is often the case, turning to the streets. Makes a resource like this incredibly relevant and incredibly important as an engagement tool to try to get people into care. The most important use of this will be as a tool that our therapist case managers and our outreach workers can use to offer somebody something to further a relationship. So when we meet people as Healthcare for the Homeless, healthcare probably isn't at the top of their list of priorities, right? It's Maslow's hierarchy of needs. People are concerned about where they're going to sleep that night, what they're going to put in their stomach, if they're going to feed an addiction that they might have. Those are the immediate needs. Healthcare, seeing a doctor, getting your blood pressure checked, right, getting eyeglasses, having a dental visit, that's probably somewhere down at the bottom of a long list of pressing needs. But if we can work with people and meet the needs that they identify, I need someplace dry to sleep. I need a change of socks. I need a bus token to get to an appointment across town. I need a sandwich. If we can meet those needs, get to know folks on a first name basis, then it becomes a lot easier to say, hey, why don't you come in and get that leg looked at? That looks like it might be getting infected. I know someone that you can talk to, right? And then that relationship lends itself to a relationship with the doctor, that then might lend itself to a relationship with a psychiatrist, that then might result in the person ultimately getting placed in permanent housing. I think the backpack bed can be a useful engagement tool to get people off the streets. We should never look at something like this as the ultimate solution. We should look at it as a tool to get people into permanent housing. We're very appreciative to use some of these as an outreach and an engagement tool to make that happen.